Good morning. Thank you for coming here and with all this snow and bad traffic. I'm really glad to present here. I'm Lőrinc Frivaldszky, and I want to talk to you about the novel approaches in improving quality of life in postpartum women. I'm working at Bethesda Children's Hospital. I'm kind of a black sheep here in this gynecological group. I will talk to you later why I chose this topic and this group. My mission is to improve the quality of life in postpartum women, and how we want to find methods that can prevent postnatal complications and that can enhance quality of life of women after childbirth. And here comes my connection to my personal area of clinical practice, that an improved quality of life for mothers means an improved quality of life for the newborn babies as well. So this is how I connect my personal field to this scientific area. I have two ongoing studies right now. The first one is investigating the efficacy and safety of esketamine on postpartum depression in women undergoing cesarean section. This started in this September. The second one, started October, is investigating the efficacy and safety of immediate administration of long-acting reversible contraception methods, or LARC methods. These are both systematic reviews. So let's talk about my first project, the effect of esketamine on postpartum depression. Why is this important? So postpartum depression, or PPD, is a prevalent, debilitating but treatable disorder in postpartum women. It has very diverse clinical features. The most important include sadness, sleep disturbances, and also suicidal behavior or thoughts. Its causes are not fully discovered. Some genetic factors and hormonal changes might play some role in its pathogenesis. And women undergoing cesarean section are especially at risk for PPD. And as of today, there is no widely used prophylactic treatment known for this disorder. Esketamine, meanwhile, it's a version of the well-known drug ketamine. It has a positive effect of treatment-resistant depression, and there are some promising data that we can use it in PPD as well. So our aim is to assess the efficacy and the safety of esketamine in prevention of postpartum depression. So we have a clinical question, that is, does esketamine reduce risk of postpartum depression in women undergoing cesarean section? We have the PICO framework here. Women with C-section is our population. The perioperative esketamine is our intervention. We want to compare it to placebo or standard of care, and we would like to measure the following outcomes: the postpartum depression rate, or how it is measured by questionnaires, like the EDPS questionnaire, its scores, and of course the adverse effects, the overall safety of this treatment. Our hypothesis is that perioperative esketamine is superior in reducing postpartum depression risk compared to placebo. And how we can turn this into an implication? So esketamine can prevent postpartum depression in women undergoing cesarean section. So we conducted a systematic search in 5 databases with slightly over 2,000 hits. You can see the search key here, like this. The search key here, I will not show it, can be seen that much. So the first domain contains the intervention, the names for this drug, and the second domain contains the population we want to measure. We found some really good key articles, some good RCTs with this search key. They have a very similar PICO, only the intervention side has some differences. It's mainly how they administer this drug, but we can take it into consideration as well. Due to the smaller number of studies and thanks to the swift work of my pair Kinche, we could finalize the title and abstract and the full text selection as well, with 8 studies finally. And we finished the data extraction yesterday, and we already sent it to analysis. So we are really hoping to get some good and quick results with this one. So let's talk about my second project. It's comparing the efficacy and safety of immediate versus standard administration of long-acting reversible contraception methods in postpartum women. Let's call them LARC methods from now on, so I won't stutter in saying that. Okay, so postpartum period is an important opportunity to reduce the incidence of unintended pregnancy. How can we do this? To provide fertile women with a safe and effective way of contraception. Why is this a big opportunity? Because almost half of postpartum women who are not breastfeeding, like not exclusively breastfeeding, receive ovulation before first 6 weeks after giving birth. And at 6 weeks postpartum, almost half of women resume intercourse, and almost half of these intercourses are unprotected. So here we can see the problem, and, but we have some promising solutions. So these LARC methods include IUDs, implanting devices, and hormonal implants, and we have some data that these have advantages if we administer them immediately after giving birth and not after the usual postpartum period. So our aim is to assess the safety and efficacy of immediate postpartum administration of these LARC methods compared to the conventional administration timing. So our question is immediate administration of LARC methods more effective than standard administration? P is postpartum women, intervention is the immediate administration of LARC methods, comparison is the standard administration. Outcomes are many, like patient satisfaction, pregnancy rates, successful immunization, and other adverse effects and other complications of this intervention. Our hypothesis is that immediate LARC administration is safer and more effective than the standard administration timing. So we can provide a safe and effective way of contraception for women who want it after giving birth. So these are my two topics, both ongoing, and we plan to submit these topics next year. And I want to thank your attention with an ancient but wise quote from the Bible. A cheerful heart is good medicine, but a crushed spirit dries up the bones. So thank you so much.
Thank you for this nice talk. I had two questions to your first topic about esketamine. Does it pass to the milk?
In this case,
affect the baby?
No, in this dosage, it is safe to use even if the woman is breastfeeding after giving birth. So it's safe to use in women for breastfeeding as well.
Okay, and about the LARC method, do you compare the safety and efficacy comparing spontaneous vaginal delivery and C-sections?
We are
because it might be different.
Yes. Thank you for the question. So with my second project, we are just started basically, and we are considering some subgroups as you mentioned, but we will take it into consideration, of course, the different ways of delivery. It will be important in the statistics.
Thank you.
My question related to your first topic about the esketamine. Is there any data about the addiction or side effects of this treatment, like addiction? Addiction, I'm sorry.
Thank you for the question. We have some data on esketamine, and compared to his older version, ketamine, it's a much safer and less inconvenient drug. Some older colleagues here may have some strange experiences with ketamine. I learned that a few weeks ago, but esketamine has a much better side effect spectrum, and mostly nausea and vomiting and dizziness are the side effects, but addiction, especially in this dosage, it's not that important.
I have a question for your first topic. You mentioned that women with cesarean section has higher risk of depression. I would like to ask why. And you mentioned the outcomes, and you would like to investigate adverse effect. So what do you mean by adverse effect, and how would you like to measure it? How would you like to evaluate it, and what kind of adverse effect are you looking for? Thank you.
Thank you for the questions. So to talk about the extra risk of C-section, this PPD is a complex psychiatrical disorder in some ways, and we don't know the exact cause why it is more prevalent in women with C-section, but some researchers think that it might be because the connection with the newborn baby, like the mental, connection with the newborn baby, it's different after a C-section. So it's a guess basically, but we think that it might play some role during C-section. And the articles we found, they report multiple outcomes. Some of these are intraoperative adverse effects, some are postoperative adverse effects. Intraoperative adverse effects include hypotension, dyspnea, hallucinations, dizziness, and most post-operative adverse effects includes vomiting, some nightmares, and beyond these, the others, like they are very rare, like hallucinations or muscular hypertonia, so they are very rare. Mostly nausea and vomiting are the most prevalent adverse effects after esketamine use.
About your first one, so you mentioned that the suicidal thoughts are very common in these groups, and we want to give them drugs which is in the usual dose. It's not addictive, it's safe to use. How in these studies, how they should be sure that the women who are given with these drugs, which can cause breathing difficulties, maybe apnea, if they are overdosed, to be on scheduled and not to overdose themselves with kind of medication. Thank you.
Thank you for the question. It's very important to measure these long-term outcomes, but these studies, these RCTs, they have shorter follow-up times, so it would need longer follow-up time, longer studies to address these long-term outcomes. But it's a very important question to ask, and I hope some studies will be able to answer it in the future.
Thanks for your presentation. I have a question regarding to the first project. So I would like to know, will you do the characteristic analysis, for example, to collect the characteristic data from the pregnancy women or the mothers as a covariant to investigate the effects and the safety to the depression? Thank you.
You mean which characteristics we want to include for maybe subgroups or something like that?
I think
yes,
it should be.
Yes, mostly age is an important factor we can use for subgroup analysis, and not all studies reported, but we can analyze them based on the number of previous pregnancies, and it will be very interesting to analyze them based on a more detailed anamnesis, like on previous psychiatrical problems or domestic abuse, but this data is not that available in these studies, unfortunately.